Thanks all for coming. Fantastic to be here for episode 2 of season 2 of the Sparked podcast series. We're speaking about specialist private provider space today, noting that Sparked covers the human life course. So we don't want or need to have various silos of data grouped according to life stage. We want that integrated life course captured in the data as well. My guest today are Michael Strachan. Michael's Head of Strategic Partnerships at Magentis Practice Management, formerly known as Genie Solutions. Sanka Amadoru. Sanka is a geriatrician working in multi-sector clinical practice and research. He's a founding director of ARIA Health and is also a clinician advisor in digital health, working with numerous organisations, including the Australian Digital Health Agency and Magentis. And Kim Drever. Kim is a developmental behavioural paediatrician, one of my favourite kinds of paediatrician. She also serves as an advisor in digital health innovation and has contributed to Lyrebird Health, a successful ambient scribe startup. Mike, can you talk a little more about the applications of Sparked across the lifespan?
Thanks, Brett. Certainly, we know Sparked has the potential to really connect all different parts of the health ecosystem. We're excited about the potential for it to connect right from Kim's in the paediatrician space, right through to aged care, which is great that we've got Sanka on the call. We see the potential for Sparked at scale right across the country to really contribute from someone being birthed in a maternity facility and their data being fireized, for want of a better word, and that being taken right through their journey as they sort of move through life. And the potential here for us and what we're talking about today is that covers both public or private, no matter where you're going in a health ecosystem, and right through from birth to your sort of more mature years. We see it as a real game changer and a really important piece of foundational infrastructure for Australia.
Fantastic. And Kim, maybe I should have started with you as the paediatrician, but there are some well-known divisions in clinical world and the hospital space, as well as professionally, that divides kids from the rest of us. How do you see the potential innovations here for whole of life course?
Well, you're right. I mean, as a developmental ped, my day-to-day is thinking about what this little person will grow up to become. I'm always thinking about a life course. That's how I think about that person's health. It's a story that begins and I may not see the end of it. And so it's really important for me to be involved in something like Sparked because it allows that information to be recorded at one time and available and move through that person's life course and their interaction with the healthcare system. That can only happen if the language is set as common from the start. It's a continuum, right? Our healthcare is a continuum, and that data must remain intact over the many decades that we hope to be on this earth.
And Sanka, at the other end of the lifespan, how do you see the potential applications of Spark?
As geriatricians, or just in general, any clinician who is looking after an older person in the health system, we're dealing with a lot of complexity, and that's not just within the person, but it's in their environment, in their ecosystem. So a lot of what we see is about transitions between and interfaces between different silos. So healthcare and aged care at a very high level, primary care, public hospital, a specialist practice, which may be, public or private, the private hospital system. So if I'm seeing someone in the emergency department, or if I'm seeing someone in a nursing home, often the things that have happened in the other areas are a black hole of information. So the Spark program is such an important piece in joining those dots and making information available so that we can make better decisions to get better outcomes for people. The other thing that's evolving is a move to increased patient-directed care or patient ownership or person ownership of their own care as digital health really starts to gain traction, and a move from institution-based or centre-based care to people's own homes, be that someone living in their own home and getting acute care or subacute care or rehab in their own home, or people in residential care getting that sort of acute care, and really connecting up the dots in real time is something that we need to be thinking about. Well, how do we join this up so we can support high quality care no matter where the person is?
Thank you. High quality care no matter where the person is. That should be our headline. Mike, turning the clock back a bit, the Spark launch event was back in August 2023 and it was sponsored by Magentis. So why have you shown such a commitment to Sparked, and what drew you there in the first place? Why have you stayed the course and moving into the next steps?
We have been a long-term supporter of the HL7 fire standard and invested in it for some time as a company. We've drawn specifically to Sparked because we see the importance of developing national standards so that we can scale what we're doing as a company, but right across industry, whether it be public, private, right across the country. The Sparked event and launching it, and the interest from our point of view, is contributing to that community as an active contributor and someone who can really share our experience so that it's in an open standard, so that it can be adopted in wide industry. And we're very big supporters of open standards so that industry can get on and start doing this now. And so our interest in Sparked is to be a big contributor to the community. We're continuing in that journey so that we can see this get adopted, not just by us, but by all of our industry colleagues, whether that be in the diagnostics, private hospitals. We see this, the importance of the Spark community set, laying the foundations so we as consumers can take our data wherever we want to go across the ecosystem. Hats off to the Spark community, is doing an amazing job of bringing so many diverse points of view together. And that's the thing that we're very excited about. And these things can start quite enthusiastic, and they do have their ups and downs in any sort of natural course of things. We've seen the community actually grow and get stronger. From the outset, it was an amazing launch and we were big supporters of it, but it's also nice to see that it's sustaining itself, in fact, growing and adding all sorts of new diverse perspectives, really changing the landscape for interoperability in the country.
Thank you. It certainly doesn't look like we've hit the crescendo yet, so good to see it on the up and up. But we have had some more challenges in getting clinician specialists on board. Kim and Sanka, you're both in that space. What's motivated you to be involved? Kim, can I start with you?
I was really pulled into it because I couldn't tolerate the inefficiencies that were just making it impossible for me to do the work that I need to do. And just as Sanka says, we were reflecting the other day about how similar our work is. We are working with patients who are ultimately vulnerable and often in the care of others, and they cannot advocate for themselves. And yet, to provide them good care, we need to have information from multiple sources. And that's sometimes sources in the health record, but sometimes it's data that sits in other places like the disability sector or the allied health sector or the education sector, and in some cases in the justice system. And all of those things matter when I'm being asked as the clinician to make a decision. I was finding that to be increasingly difficult, and I'm having to ask the patients actually to be the people that bring the data to me. I was reflecting on this the other day thinking, the most efficient way to get the data I need to me at the right time is the mum's folder or the parents folder. They literally come in with a lever arch folder of all the things that they've done and been to. Nowadays, it's not so much a lever arch folder, but it might be their email inbox. And so I'll have my own struggles, and I know it's been talked about on the podcast before, trying to access images, trying to get downloaded discharge summaries from a hospital that doesn't speak to my software. All of that stuff is my trouble. But then I'll say to the family, but I need that psych report. Daily when that happens and you have families putting aside time, spending a lot of money in private practice to come and see me, and I can't give them that direction because I am hampered and limited by what I have in front of me, that feels really awful. I guess one of the reasons I come in is I'm very good at complaining because I'm a diagnostician. I think all of us clinicians are good at pointing out what the problems are, but I don't have a low tolerance for people who don't actually kind of do something about how to fix it. And so Sparked was a way that I could see I could have some influence in improving the flow of information in and out, bringing it up to my eyes when I need it. So that's why I'm here.
Fantastic. I found my little paediatric folder the other day.
Oh, did you?
Little Brett Andrew Sutton, 5 pounds, 2.5 ounces, super prem. But yeah, there's a lot more information that we're all carrying with us now, and the needs are growing exponentially. Sanka, does that vision resonate with you about the potential solutions that we're trying to achieve here?
Just following on from what Kim said, having a deep understanding of the problems and the frustrations that we kind of accept as being part of clinical practice is something that we could just sit around and complain about. Being able to say, look, there is something I can do, and I could keep seeing patient after patient and that's all I do, or I can do a little bit extra around the side being contributing to Spark or other things in the digital health space, and then actually have impact at scale, perhaps addressing this problem that I see every day and addressing it for potentially lots of other clinicians around the country and many other patients who are going to be seen by them now and in the future.
And what would you say to other clinicians who aren't sure about whether they should contribute to the community?
So 3 main things, Brett. The first thing will be, if you're interested in the area, follow your interest. That's, I think, a necessary part of it. The second thing is, don't undervalue or discount your experience as not being valuable, because it is. When you're talking with people who are not necessarily working in the clinical space, the things that seem obvious to you can have a huge impact and make a huge difference with the contributions. And that's something certainly that I was concerned about initially, and then I started to see the things I was saying landing and having that sort of impact. And people are very receptive and open to that. It's a very fulfilling thing to do. And finally, there's a very clear need for clinicians in projects like this. And the more clinician input there is, the better the end product is going to be when it's being used by clinicians. At this stage of the digital transformation journey, getting involved as a clinician is really an opportunity to make history.
And Kim, how would you frame the Spark community to your colleagues in terms of being involved?
The first barrier often to becoming involved in something like this is getting over that resentment. It's almost a learned helplessness, I hate to say, and I've had to confront that myself. Michael and those at Genie are used to me complaining about things not being right. It's important to get that bigger picture and go, listen, we know it's hard here, but if you step back, there is a way that we can use what we know of what it's like to be in front of a patient. In paediatrics, the decisions I make are time sensitive. I need to make a decision now. If we want to improve that, we have to be feeding back in a very dynamic way, and we need to trust that it's being heard. But you can't do that if you don't put yourself into that conversation, if you don't insert yourself into that community. And so sort of getting over this idea that, I don't get to make the decision about what EMR's in my hospital, so I just deal with it. Or, it's the boss of my clinic who chooses it. Well, you do have agency. I think we underrate what we are doing when we're in front of a patient. We're multilingual. We're speaking the medical stuff in our minds. We're observing and taking in all of what we can see and elicit with physical examination. Then we're talking, in my case, to the child and trying to involve them, and then to the parents who are concerned. And then at the end of it, put all that together and decide what is the next best step. And that takes up a lot of space in my head. If we want technology to assist us with some of the boring bits, which is the data entry, and I'm not just talking scribes, I'm also talking automating workflows. If we want that to work well so that we can do that really beautiful work with parents, then we have to be part of co-designing and telling them what needs to be done. That they want to serve us, I think. There's this kind of us and them mentality, which I think we just need to break down. Now's the time.
Very well said. Sanka, in your role as a geriatrician beyond that point of care, what's the value in having better data?
The value of accurate data being there when we need it, when we're looking after older people, is very difficult to overstate. So much of the decision-making depends on lots of different moving parts and understanding how they're moving. The main value I see in it is in improving clinical care and improving patient outcomes. But there are other things, and I really like this framework of the quintuple aim. So you're improving outcomes as the first of the 5 things, but you're also improving the patient experience because they're not having to tell their story for the zillionth time. You're improving the clinician experience because they're not having to spend half the consult dredging up information that already exists elsewhere. And that makes a big difference, particularly in the private sector, given the funding incentives and funding models. So if you're spending less time yourself, or you can decrease the amount of time that your admin staff is spending, then you're saving time and therefore costs. And the fifth thing, and I'm really big on this one, is equity in healthcare. And if we're talking about connecting up things and what is the value of that, well, it means that people who are not as health literate, the people who are not as digitally literate, can have the ecosystem support them and support the clinicians and get to more equitable healthcare outcomes for them.
I love that. The idea that if you have to navigate a labyrinthine morass, those who are least able to do so are going to be at significant disadvantage. And so it is a levelling infrastructure, if you like, that helps lift those who are most at risk in many respects up, amongst others.
And now it's time for a fun fact from Kate.
To date, 18,000 in-kind expert hours have been delivered by the Sparked community.
And Kim, what about the skin you have in the game? What's the real value for you in your work?
I mean, how long have you got? It's been a very interesting road. I fell into this role literally because I felt desperate and did not want to continue. I just thought I did medicine to be helpful. You know, I'm a smart person. We're all smart people here. But those of us who choose to become clinicians, we want to use our skills to help other people. And I think toward the end of the pandemic in particular, it just wasn't fun anymore. Everyone was tired. The patients that I look after with chronic diseases and challenging behaviours, they have wonky chromosomes, so their bodies don't work as you expect them to, and their brains are a bit quirky and spicy. I just wasn't able to coordinate care for them. I was kind of giving up, to be honest. I lost a couple of patients to suicide, just because our mental health service was just awful. And that's not the medicine I practice. So feeling rather despondent, I went to a conference, and it was a mate of mine during the coffee break who said, oh, look at this little thing. He'd downloaded this little app and said, oh, I haven't lifted up a pen in weeks. And I went, oh, that's awesome. Because I just lost my secretary. She had burnt out, and suddenly here I am. And I think this is underappreciated too, and I'm sure Sanka will agree, that in our work, I don't cut people open. You know, I'm not a brain surgeon. I can't give you a new hip. But our work is all about advocating, and advocating requires nuanced communication depending on what that patient needs. Talking to education, justice system, mental health system, hospital, private providers, NDIS reports, don't even get me started. That is the burden that I have. And every one of those communications, I can't write one letter. I have to write many. Without admin support and feeling like I wanted to give up and a pile of paperwork, this seemed like a perfect little tool. I'd read quite a lot about AI, and I realised that AI is an old baby. It's been around for a long time in medicine. We don't need to be afraid of it, but it's muscled up now. How do we harness it is one thing that I'm interested in. But anyway, getting into the scribes, realising it wasn't working that well, spoke to these founders who are not medical, they're technical, so to me they're magicians. I could tell them that this was not picking up what I needed it to. Turns out that orthopaedic surgeons, who were the first to adopt it for that company, don't do the same work as a paediatrician. Funny that. The magic for me was when they were open enough to go, well, what do you need? And we worked with it for a bit, and it got good enough. And I thought, this is amazing. It certainly made a huge difference. I essentially got home for dinner, right? That was huge for me. And then I felt that I was actually being helpful. I was getting the reports out in time. Yes, I had to edit them, but most of it was done. And so I felt again like I could be helpful. The thing that I was surprised about, because I was very concerned about taking on anything that had AI deployed in it, and so I ran them through their paces. Is this safe? I was desperate to use it, but I was frightened because for me, and I think this way about data generally as well, all the healthcare data, it's not mine. I'm a curator of that data. It's on loan to me. I'm trusted by that patient, by the child, who isn't giving consent, by the way. It's the benevolent carer who is doing that, but they're trusting me to put that into the note, and it's going to persist for a long time. So I wanted to be sure whatever tool I use is going to honour the way that I approach data. So I guess that is the other reason that I stay involved. It's like we need to have people who understand how important it is to be careful with this data and use it for the intended purpose so that the patients get the right care at the right time.
I think it speaks to the importance of the Sparked community in making sure that where you've got software as a medical device or a quality management system, that you're delivering a quality solution that is safe as well as efficient. Terrific illustration. Mike, what do you think the Sparked community can deliver in terms of innovations that might be picked up by Magentis?
One of the values of the Spark community is starting to get out there and test things now. Think about a big waterfall project. Think about a piece of national infrastructure, or you could start with a bottoms-up approach, which is what Spark has done, collaborating with the community and getting out there and testing things right now. From what I see in the Spark community, there's such a groundswell, not just software providers, but right across the industry that want to start this sooner rather than later and start learning. We talk about patient summary, and I think that's a really good national asset, but there's going to be practical implementation. How are we going to actually do this thing at scale? We shouldn't wait for something to come. We should get out there and start doing it now. So from our point of view, we're doing that. We start now. We don't wait for a waterfall to happen. Let's get out there and let's get industry doing it sooner, and not wait for some mystical thing to come and solve it. And that's where I think not just Magentis, other players in industry that do have different parts of the ecosystem covered should get on and start doing it now.
Well, and kudos to you all for being involved. No pun intended, Kim. You've all been at Sparked events. What, other than being, orange and sparkly, what's it like being at a Sparked event? Sanka?
The thing that struck me most, Brett, was the energy and the excitement in the room. Everyone was there because they wanted to be there rather than because of some sense of obligation or because they were told to. That motivation, that drive was palpable. And the other thing that I think was really exciting is that people were talking to colleagues from other disciplines, totally different sectors that they hadn't necessarily come into contact with before. And just the excitement around that was really quite cool. Speaking from my own experience as a clinician, being able to come in and say, in inverted commas, the obvious thing, which is actually potentially game-changing for a technical colleague. It feels good when you can do that and you can see that this is going to have some downstream benefits. And I guess if you talk about this from a more theoretical perspective, it's very clear that involving multiple people and multiple stakeholders, and particularly clinicians, is really important in avoiding the last mile problem where it's something that is technically built and has a lot of investment and it kind of falls over when it's deployed in the real world. So I think having people from various disciplines, including clinicians in the room, that is what's leading to the excitement. I think people get that and people are really pumped to have everyone there working towards a common goal and there at the right time, early in the piece when time is a factor.
And Kim, for you at Sparked events, how does it feel?
I love a good party. It feels like a party of nerds and I love it. It feels like stepping into what I hope that healthcare change is like. You read about it. I've done a master's in public health and studied change management, and it's all about everybody talking and everybody being on the same page. But the reality is that up until now, it hasn't often felt that way. We're all protecting our turf. There's limited resources and we have to be smart about how we use them. And so everybody remains in their little silo. Lip service is paid to being collaborative. But I love them because I feel energized. I'm actually seeing true collaboration. People are coming there incredibly bright. Every time I go up to some person and introduce myself, I'm floored by who it is. You've got people who have been the architects of digital health. They've seen it from ages ago and they've been building towards it. And now we have all this expertise in the one place and we're all wanting to share what we know to improve healthcare. That's why we're there. We're all there in service of our community. So I find it super energizing and a little bit intimidating at times. And I guess the other thing I find really kind of cool is I'm at a point in my career now where I feel like I've done everything. Well, I say I know a lot, don't know everything, as my little, patients will tell me I don't know everything. But I know a lot. I feel quite skilled and I feel like, my expertise, where's it going to go? Like, does it just evaporate with me when I retire? But here's an opportunity and people are crying out for it. And I actually think clinicians who have been doing it for decades, we have a responsibility to speak into this program because we get to infuse our knowledge and our wisdom into what will become the infrastructure in which we deliver healthcare. So I find all of that very motivating and exciting. And it's lifted me out of wanting to give up to, there's hope. And actually, the awful time that I had during COVID, there's somewhere for it to go. I feel like it hasn't been for nothing. I just love it. I think it's great. I learned so much too. Oh my God, I've learned a lot.
Well, we're very glad you're in the space with us. You're right. There are lots and lots of big star performers. David Rowlands is the Henry Rowlands of HL7. Terrific. And Mike, you've been involved. How do you find it all?
Both Sanka and Kim have covered it very well, and I've had the same experience. I've been to most of the Sparked events. The community is superb. It's hard to describe. It's really got that essence of a community that has psychological safety, everyone's opinions or voice is heard, and is genuinely trying to bring everyone together. From industry, there's competitors in the room that are leaving all that at the door because we know that we're doing something really important for everyone, all of us as consumers. I love hearing Harry, who's one of the consumers in the room, advocating for the consumer point of view. Getting to know people from different points of view is certainly the value that I found from it. We have a bit of fun. Ebra will often say it's a community and the Spark, it's fun. It's important stuff, but you have to have a bit of fun. Any community that is achieving something great like this community needs to have a bit of fun on the way. Otherwise, why would you want to be there? I've really enjoyed the experience and seen a lot in my career in terms of changes, particularly in digital health. I genuinely have the same hope that Kim shares, Sanka shares, that this is setting us up for future generations to really not be talking about this disconnected world that we live in at the moment.
And so what does success look like for you? A folder-free world?
Certainly that should be absolutely the aim. Brett's success looks like getting out there and starting the journey and not waiting. I see lots of opportunities, particularly with the horsepower in the Spark community, to do things at scale. And now that we've set the foundational work of agreeing on some of those standards, it's now how do we start to get some benefits in the community, whether that's public, private, and start working on that. What is it that we as a community can get out there and start doing and demonstrating and showing real consumer value? To me, the future is real scale of adoption.
I just want to talk to a small picture thing. So for about 8 years, I think, I've been asking my practice management to have a different set of growth charts in there for paediatricians. One of the most common conditions in our community is trisomy 21, genetic conditions, and they have a special growth chart, and it's not in any practice management software that I'm aware of. So I have been asking Michael, is there a way that we can improve the selection of growth charts? He's been very patient and has worked really hard to make that happen. And being in that Sparked community, there are people there who understand the issue, and Michael has very kindly introduced me to some of those people, and it's meant that we've been able to sort of attack that problem together. And maybe, Michael, you can speak to it better. That, for me, that is such a cool thing that we can raise those real world issues and start to get really clever people thinking about them.
Kim's done some great research on this and found the Royal College of Paediatricians in the UK have an appropriate version. And by the way, it's based on the FHIR UK core. So we're excited because we hope that will translate. It should translate, by the way, to AU core and be a viable option that could be used not just by our PMS, but other PMSs that adopt FHIR, right? It's not happened yet, by the way, just to be clear, but it's in the process. And have that as a national asset that could be used by anyone that can use FHIR because it's international standard. We're hoping that will be an asset that could be deployed not just for Magentis, but any other software vendor that is committed to FHIR.
And none of this is possible until you have those conversations between those who are advocating for solutions and those who might know the path. Sanka, your reflections?
When we're thinking about success in the short term, success looks like what's happening now. So increasing momentum, more and more of the right type of people in the room. That's happening, and it's fantastic. And when we think about the long term, for me, it's very much a practical, what does this look like in the clinic or in a hospital in the real world? And what that looks like is a person who is receiving or participating in their own healthcare saying, I had a good experience and I am getting the care that I need. And the clinician, in contrast to what is commonly said now, and this is kind of alluding to the very real and widespread and increasing problem of burnout that you were talking about before, Kim. So clinicians saying, this is not why I signed up to be a doctor. This is not why I did a nursing degree, or this is not why I insert profession here. Instead, the clinician is saying, I'm doing what I want to be doing, and I'm doing something that is impactful, and I'm not wasting time chasing up other stuff. If we can get to that point, I think that's what success looks like.
Kim, you get the last word.
Talk about being part of a Sparked community. Sometimes I feel like my brain is like a fireworks. It's just like things sparking up all over the place. I always feel a sense of urgency, and maybe that's because the work that I do is time sensitive. I need to make a decision today, the most effective decision that's going to leverage the most return on investment well beyond the time that I'm involved in that patient's care. I do want to look for the greatest return on the decisions I make. If Sparked works well, and if we are able to agree as an industry on how we collect, transmit, give access to in a timely way to the data that clinicians and the healthcare system need to service the patient, then that would be amazing. I mean, that's what we want, right? If I look at the points that I made, I said success is a system that works for clinicians and not against them, so that we can focus on what truly matters, and that's being in the moment with the patient, listening and applying our skills with our whole self. It means that when patients seek care, their data moves with them and there's no holes in it. If we have a question, we can interrogate their health corp or their body of their health data. And if then the transfer of the data is seamless, we don't have to think about it. It just happens. I don't have to think, oh, that's right, they're using this practice management software. I'm going to have to download it as a PDF and then scan it. Oh, my scanner's not working. Will you accept a photograph? And then if everybody wants to harness the great potential that AI brings to data, if we really want to harness that and use it and deploy it effectively in a digital healthcare system, the data has to be clean. And the way that we do that is to start with the basics, as we are in Spark, the core of the core data, and then start thinking about the main ways that we can apply these amazing tools to give us the assistance that we need to amplify and improve the quality of care we provide, and we can trust it. Because there's a lot of mistrust about AI. Everyone likes to say garbage in, garbage out. Absolutely. But the AI between these two temples here is also imperfect. I'm not sure that I trust it all the time. I would love to have a companion that is assisting me and I can trust it because I know that the data's been entered in a certain way, and that when it interacts or assists me to interact with other parts of the digital health system, it is going to speak the same language. So I guess success for me means sometimes to get to that scale, we have to do things that don't scale. That's a very startup cliche. And this is one of those things. But I get the sense that right now, all the stars are aligning, and we do have an opportunity to take it forward and maybe avoid some of the mistakes that we've made in the past.
Great summary. Thank you. Thanks, everyone. I think that's a wrap. Really appreciate your time and your insights. It was a good chat.
The Sparked podcast is brought to you by the Australian Federal Department of Health and Aged Care, CSIRO's Australian eHealth Research Centre, HL7 Australia, and the Australian Digital Health Agency. You can join the community by heading to sparked.csiro.au. And don't forget to join us on LinkedIn at SparkedAU. This show is hosted by me, Brett Sutton, Director of Health and Biosecurity at CSIRO, and produced by Ed Studios' Janine Hamer and Lucy Ratz, and CSIRO's Dr. Naomi Stecklenburg. Sound by Hayley Dell.